Regional anesthesia in ophthalmology, best practice. Anesthesia for ophthalmologic surgery. All the patients must have a pre-anesthetic medical evaluation and a complete review of the medical history. In the screening area, the eye which will be operated must be confirmed. Measure the vital signs and confirm they are on an empty stomach. In the block area, a manual ventilation system, a source of oxygen, basic monitoring equipment, and everything necessary for the care during a cold blue, including a crash cart, must be available and in operation. The mix of local anesthetic for the parabulbar block must contain, apart from local anesthetic, hyaluronidase at a final concentration, that is, at the volume to be injected of 3.75 international units per milliliter. Regardless of the mixes, it is important to take the following into account. A. The hyaluronidase mix with a local anesthetic is stable for 72 hours. B. The hyaluronidase mix with saline solution is stable for 15 days. In our case, the hyaluronidase will be prepared in the following manner. A bag of 100 milliliters of normal saline solution at 0.9%. 50 milliliters is removed with the help of a sterile syringe. In the 50 milliliters of normal saline solution which remain in the bag, 10 vials of hyaluronidase of 150 international units are diluted. $50 milliliters of normal saline solution plus 10 vials of 150 international units per milliliters of hyaluronidase equals 50 milliliters of normal saline solution plus 1500 international units per milliliter of hyaluronidase. Thus, the final concentration of hyaluronidase in the bag of 50 milliliters will have 30 international units per milliliter. The bag must be labeled indicating the concentration, day, and hour. The bag must be refrigerated. When applying the anesthesia, take the bag from the refrigerator and in a 10 milliliter syringe, take 1 milliliter for every block expected to apply during the shift. For example, if there are 6 patients programmed during the shift, then 6 milliliters are taken. In this case, there are 4 blocks. Therefore, 4 milliliters are required. The syringe with the centimeters to be used during the shift must conserve the cold chain by placing it in a cooler. Afterwards, the bag must be placed in the refrigerator. This refrigerated mix is stable for 14 days. Once the patient is in the block area, the patient is monitored and is administered oxygen through a facial mask. Once the safety conditions have been verified, the patient is applied 50 micrograms of diluted fentanyl, up to 5 milliliters of saline solution. A drop of alkane is applied in the eye which will be operated. The topical anesthetics are applied by drops in a controlled manner, given that its excessive use produces edema of the cornea, which makes the surgery difficult by impairing the vision of the surgeon inside the eye. The intraocular pressure is measured with the applanation tonometer. The asepsis is carried out in the area where the block will be applied with iodine solution. Then the anesthetic is prepared thusly. Given that the volume used for the parabulbar block for cataract surgery varies between 6 and 8 milliliters, it takes 1 milliliter of the syringe with a mix of hyaluronidase which contains 30 international units per milliliter. This volume taken from the syringe, which contains 30 international units per milliliter of hyaluronidase, is mixed with levobupivacaine at 0.75% until completing a total of 8 milliliters. The final mix will be made up of levobupivacaine in a concentration of 3.75 international units per milliliter of hyaluronidase. After 3 minutes of having applied the fentanyl and previous application of 40 milligrams of injected lidocaine, propofol is applied according to the age of the patient thusly. Why lidocaine cannot be mixed with levobupivacaine? Because the minimum time of the balloon is 15 minutes, and this time is sufficient for the levobupivacaine to begin its effect. 2. Because the affinity coefficient of the levobupivacaine is greater than the lidocaine. This means that if both are before the receptor at the same time, the levobupivacaine will join the receptor and will not allow the lidocaine to have its effect. In accordance with the established references and the described technique for the parabulbar block, 4 milliliters of the anesthetic mix are applied, plus hyaluronidase in the lower temporal part, and 4 milliliters in the upper nasal part. Before initiating the injection of the anesthetic, it is indispensable to verify that the injection is not found intraocular. This is done by moving the eyeball to see the free movement of the orbit and of the syringe, and permanently monitoring the eyeball during the anesthetic procedure. The Hohn balloon is placed. The mobility and palpebral aperture is evaluated at minutes 5 and 10. At 15 minutes, the ocular pressure is taken again, which should be around 20 centimeters of water. Movement, sensitivity, and pressure are evaluated before taking the patient into surgery. The patient is moved to the surgery room for surgery. Once the surgery is completed, the patient on his own walks to the post-anesthetic care unit.